Welcome, everyone, to another episode of hashtag CRA Arthritis. One of the annual highlights of the CRA meeting is a program called The Great Debate, where two teams of experts debate from opposing sides, one in favor, one against, about a hot topic in arthritis in a usually friendly and fun atmosphere that I certainly always find both educational and entertaining. This year, the debaters are arguing whether medication should be tapered in patients with inflammatory arthritis in remission. And we're lucky to have one of the debaters, Alexandra Charlton, joining us today. Alexandra, welcome.
Thank you.
Alexandra is a lead pharmacist in the Division of Rheumatology at the Cumming School of Medicine at the University of Calgary. She currently works as a pharmacist at the Richmond Road Diagnostic and Treatment Center, and she's also a pharmacist clinical practice leader at Alberta Health Services. To start off, Alexandra, I really have to say I appreciate your courage agreeing to be a debater at this event because it usually gets some of the biggest crowd reactions and can get very personal.
I'm looking forward to it. So I get to debate my colleague. So it might get extra personal this year.
Oh, wow. So somebody that, oh, and who's that?
Glenn Hazelwood.
Oh, of course. Wow. So on opposing sides, friendly fire indeed.
Betcha.
I'll be looking forward to that.
Mhm.
Um, you're arguing against tapering medications in remission. So to start off and to help our audience, I'm going to start with asking you about a definition and what does it mean to be in remission, and why might reducing or stopping medications even be considered in the first place?
Well, that's actually one of the hot points that we are going to be talking about. So different guidelines and even within different disease states within rheumatology have different sort of recommendations about what a remission is and how long it should be and how what they call deep it should be for JIA or juvenile arthritis.
Mhm.
They actually, a lot of the guidelines talk about inactive disease, not just in remission. So right now there is not a good definition, and different guidelines use different tools, and the tools are not necessarily accurate for determining remission. So that in itself is one of the current issues with tapering, is that definition of remission.
Sure. So what are some of the biggest risks patients should understand when it comes to reducing or stopping their treatment?
So it's going to be very variable per patient. For some patients, there's going to be not a significant risk necessarily. Patients who have relatively mild disease, who are younger, who are on particularly more than one drug and have other drugs to choose from, those are probably lower risk. Someone who's had disease for a long time, someone who has very aggressive disease with already damaged joints or changes. A flare, even for a short period of time, that's induced by tapering, could be detrimental. And in some people as well, the potential of steroids being needed to manage while we instigate a higher dose or a medication for the patient can also have detrimental effects. If they've already got osteoporosis or diabetes, and now we've got to put them on prednisone, that's going to be a much higher risk for someone who has no other comorbidities. So it is very variable, which is why we're arguing that it shouldn't include all patients.
So I'm interested in your experience as a pharmacist working closely with patients and their care teams. What specific factors should be carefully considered before any decision is made about tapering a medication?
So their past history of medications is important, how long they've had the disease, how difficult it's been to get them into a remission or low disease activity. Even some things that people may not think of is there's a lot of anxiety around medication, but there's also a lot of anxiety around flaring again. And some people, that stress, it can itself be problematic for their overall health. It can affect their family. It can affect all kinds of things, and that fear of flaring in some studies has even been shown to be as problematic as actual flaring, just because they become overly sensitive to, am I in a flare? Am I, if I have a flare, am I going to miss my vacation? Just different things like that that have been pointed out in different studies that oftentimes people don't think about. Often we just think about the disease and, what's the flare going to do and whatever. But there's a mental health and kind of component there as well.
I'm glad you touched on that because when I'm speaking to people living with inflammatory arthritis who actually are feeling well and wondering if they can reduce their medication, they're often looking for advice on how to have that conversation safely, appropriately with their healthcare team. What sort of advice can you give those people?
Well, I think it's important to be honest. Like, I think when a healthcare professional brings up something like tapering, it it feels like it may be more than just a suggestion. It's like the healthcare professional wants them to do it when maybe they don't feel comfortable. So I think it's important that they express those concerns. And I'm a rheumatoid arthritis patient of 36 years now. And I'm one of those patients that's terrified to taper. I remember being on my gold shots forever after they stopped working, just because I was terrified to go back to how I was previously. And to people that haven't experienced that in real life, I think it's something they don't quite understand.
Mm,
And I think if you strongly are very concerned about trying to taper, and it's gonna cause anxiety. I mean, it's risk versus benefit, but I think patients have to be honest about how they feel and don't just do it because the rheumatologist, thinks they could or should. In some cases, patients are on board or may have already tapered themselves. But then there's other people like me who are a little more scared to play around with their medications. And I think sometimes all of us with a science background forget that there is a definite mental component about changing medications in any way, up or down.
well, thank you for that. We are going to have some more information at the end of this episode where people can learn more about this really important topic. Thank you again, Alexandra, and thanks to our audience for joining us, and hope to see you on another episode of hashtag CRA Arthritis. Bye for now.